Good afternoon. I'm Fabrice de Genève, Managing Director of Johnson & Johnson Medical Device, Belgium, Luxembourg. I'm pleased to open this third and final webinar focusing on the COVID-19 outbreak, organized in partnership with the Belgian Association of Hospital Directors. When we started this initiative, we reached out to a couple of hospital directors and captured their current concern and question on this unique situation to build the content for those dialogue sessions. During the first webinar, we discussed with Dr. Paul Stoffel to understand the context of this virus, learn from his previous experience on virus outbreak management. He gave also a better outlook on the different vaccine development projects, and finally, how we should prepare ourselves in the future. On the second one, with the support of human resource experts, we learn how to maintain connection and manage healthcare staff who were acting on the front line every day, and how technology could be one of the solutions during those acute situations. Today, with our selected panel, we will discuss how we can capitalize on the current momentum and adopt a new approach, and discuss how healthcare should be delivered in Belgium for the benefit of the patient. We will use the same approach in having a conversation with all the speakers. Using this live transmission, you will have the possibility at any moment to ask questions to the moderators in using the chat tab located on the right-hand side of the screen. So let me now introduce our panel and our moderators. So we have three speakers today. I will start with Dr. Yves Bressen, who has a long managerial experience as a YESA hospital as a CEO and a trained gastroenterologist doctors from KUL Leuven. We have also Professor Frank Vermassen. He's the head thoracic and vascular department at University of Ghent. He will share his perspective on how to optimize patients with this new environment. We'll have also Dr. Hervé Delabrière, who is currently Chief Medical Officer at Iris South Hospital Group. Dr. Delabrière is a trained anesthesiologist and have accumulated experience in different sites in the Brussels region around multidisciplinary organization management. And let me now introduce our moderator, Juan Barubes, who is managing partner at Antares Consulting. Juan is a senior consultant with focused attention on international healthcare environment. And our second moderator will be Vark van Utten, who has joined recently Antares Consulting as a partner following an extensive career in Belgium hospital management. And he was previously CEO of OLV Hospital Group. And finally, to conclude this session, Dr. Gilbert Bejani will close the session and give his perspective on what we should reflect moving forward. Dr. Bejani is an experienced anesthesiologist currently practicing at Chirac Hospital, Brussels, and General Secretary of Belgian Physician Syndicates. Johan, the floor is yours in opening this dialogue with our panel.
Many thanks, Mr. Dezenève, for this introduction, and thanks to Johnson & Johnson and the Belgian Hospital Association to organize this series of webinars. In this webinar, we will like to discuss how with three hospital leaders how we can use the recent experience during the COVID crisis to drive and to accelerate changes for our healthcare systems. I would like to thank, obviously, the three speakers that they generally accept to participate to this debate. The idea is to have a positive approach. We know that this last week, as one of you said on the previous conversation, has been a kind of nightmare for most of you and your teams. The idea today will be to discuss how we can move from a nightmare context to a to a new hope, if you can say it in some way. The topics that we will like to discuss in this debate is about the future of hospitals, how this could impact the future of hospitals, how we can, how will this crisis affect the healthcare reforms, the financial impact also, how it will affect the innovation on care delivery and value-based care, and how will affect hospital management, leadership, and also on how will affect the health professional management. So that will be the topics that we will discuss during this afternoon, and then we will move to open questions to the audience through an application, an app that you will see instructions after the debate, and that we will receive your opinion, all the attendance, and we will open the discussion. So I propose to move to the first topic. The first topic is about the future of hospitals. We, after this very important health crisis that we have faced, the question is how the hospitals will look like in the coming months. Why we will have at least two kind of patients, if we can say it like this. The COVID-19 patients will be still there. We hope that less than these last weeks, and the non-COVID patients. And that means that the need to minimize waiting times and rooms, increasing digitalization, basically how these changes will affect the hospitals in the coming weeks and also in the long term. We guess that Dr. Breinsen open the answers and then leave time for the other speakers.
Yes. Good evening. Can you hear me well?
Very well.
Yes. Thank you. Good evening, everyone. Yes, you mentioned it already. 2 months ago, it was a hard time, and we had to switch to another hospital in a few moments. Everyone in the hospital, the nurses, the physicians, has seen the television images of Italy, and they were engaged to make a very quick switch. Now, the last few weeks, we have another switch with very much of uncertainty, and we feel that the nurses, the physicians who were working on a very high adrenaline kick now are uncertain about the future, what will happen in the hospital. We had to make a new hospital, a hospital with 2 ways for COVID patients, for non-COVID patients. Physicians are angering to start again, and we don't know what will happen in the coming months, in the coming year. So also for us, for the management of the hospital, it is an uncertain time with 2 competing demands. We have a responsibility to meet today's challenges, and we need to plan ahead in order to thrive in a tomorrow, in a new normal. So that's very difficult. The hospital will not be the same again in that world of tomorrow. So I'm very happy that in every hospital, I suppose in our hospital also, there is a tremendous flexibility of the nurses, of the physicians, of every co-worker. And yes, we have the gradual restart, the dual care organization. We have to put a screening mechanism to all the hospitalized patients, also to organize our outpatient care. That's not so simple. There we can't screen. We have to provide personal protections measures to all the patients and their accompanying partner. Minimal use of the waiting rooms. So notifications of text messages that people won't come too early to the hospital. So it is a very complex situation, but also a moment to implement some optimizations we had in our head for doing the next year, perhaps short stay, more digitalizations, a reduction of waiting time. So it is a a very busy time now with great uncertainty.
Many thanks, many thanks. We keep the idea of uncertain times, but also opportunity times to implement some changes that we have on mind during the last years. Dr. Vermaassen, how do you think that the hospitals would look like in the coming months?
Well, actually, well, a lot has been said already about what happened in the future. I must say that region where my colleague Dr. Versums is working, of course, was more affected than the Ghent region, for instance, which makes that we actually were never overcrowded. So we, of course, we had to change a lot, but well, also thanks to the fact that we were all prepared from very beginning. We never really had big problems. This withstanding, I do agree that in the future, of course, hospitals will be a bit different. And what we've learned from it is that flexibility, you already mentioned the word, will become more and more important when we have to handle, you know, what's called a second wave. I'm not sure. I hope it will not be a tsunami. I don't believe it will. Probably these will be, and hopefully these will be smaller waves when they're still coming. That we have to be able to handle these, and at the same time also provide the care to the non-COVID patients, which is needed also. We cannot afford to do the same again and let's say put almost to zero the care of the non-COVID patients, except very urgent ones. So with regard to the organization of hospitals, I think this flexibility will indeed be very important, as we have to keep some capacity when something happens. I'm not so sure that this capacity has to be so big, but it has to be flexible. And that, of course, you know, what we see with the COVID patients that are still in the hospital now, many of these, there are not so many new cases, but there are still a lot of patients that had COVID. With regard to capacity, we have to keep in mind that after a certain time, these patients are actually no longer infective, so that they will be in the hospital, but probably they can be handled like just the non-COVID patients. So, well, I'm not so pessimistic about the possibility to organize this dual care in the future.
Many thanks, many thanks. And Dr. de la Drière, what's your opinion on this topic?
Yes, good evening to everyone. But everything is already said. In fact, it's easy to speak in the third position. You speak about a nightmare. I prefer to speak about a new life. The hospital will be an attempt to live with a virus. In fact, it will be an organization with schizophrenic, certainly a deal with the fear of the patient and of the healthcare worker, a deal with the marketing, because it's a really big thing that we have to think that which hospital do the best, and for our image it's really important. But with that, it's an attempt to deal too with the day by day. In fact, as my colleague said, everything is really uncertain except an inefficient organization, an expensive organization, and with poor rentability. Then for the future, I prefer to speak new life with the agility that we had a few weeks before, with flexibility and certainly with wisdom, and be confident that we will find a solution step by step. But we don't have already a program to know where we are in 6 months or in 1 year. It will be completely different. I hope we will be out by the digitalization and so on. But it was only small steps, you know. It was only an adaptation. No, we have to go further with something art and something constructive. But in the next month, it will be uncertain, and we have to be adapted, and we have to be flexible for the rest. I don't have other consideration for that.
Very interesting. I think it's a very good point. This adapting context and flexibility and agility. I would like to go to move to the next topic. One of the questions that we had in mind is how this crisis will affect the healthcare reforms that we face in Belgium, and especially one thing that has been important during the crisis, the healthcare networks. How will be affected by this recent experience? We will accelerate the healthcare networks. We will reshape more focus on medical cooperations or more joint programs within the network. For this question, we will do it on the other side. We will start with Dr. Delabriere to answer the question.
And at first step, I'm really severe with at first step, because we have to dream that the first step of the network, the dreams of Mrs. BeLux, it was less emergency room, less intensive care units, and more bed for the chronic disease. Fortunately, we were not so far. I think, no, we have to know which healthcare system that we want, or an insurance system, and we have to consider these kinds of events, or a pure medical economic system. And I think we have to know that to find a good balance between the two. But I think before to speak about networks, I have to say the first steps I am waiting, and I think we are waiting more coherence for the authorities. I think it's the first step before to speak about the networks between the hospitals. This crisis shows the inefficiency of our several authorities, healthcare authorities, I mean public. And before to go further, before to speak about the networks between the hospitals, I think we have to wait something coherent, something where everybody speaks the same language with the same weighting. And after that, we can go further. Which kind of healthcare that we need, which kind of healthcare that we want, and which kind of side effect that give. But first step, coherence into authorities before.
Thank you very much. Thank you very much. And Dr. Vermassen, how do you think it will affect this crisis with the healthcare reforms?
I'm not so sure it will affect profoundly the healthcare reforms with regard to networking. What it does is to make clear that indeed hospitals have to speak to each other, and they have to help each other when needed. It has become clear that also some we have to speak to each other in order to have the same guidelines, for instance, with regard to certain topics. And that's important. You know, the healthcare reforms with regard to networks, don't forget that the purpose was to create local regional networks. And therefore, it will also be important to make this link to the first line. And that also becomes, it was obvious that this is important to work together with the general practitioners. And also, for instance, with the elderly care institutions, I think this crisis made clear that some connection between these elderly care institutions and hospitals will be one of the issues that has to be solved in the future.
Thank you very much. Dr. Brensen?
Yes, I'm convinced that networking, local, regional, is a good thing for the healthcare of the population. But in the start of this crisis, we saw, and I can speak only for our network, that we weren't yet prepared for have a central command. In the crisis, you must have a central command to make very quick movements. And that wasn't yet installed. So every hospital started his own organization, but we, like already said, we were a region that was very high virulent, with many patients in a quick time. So there was very soon in our network, and then with the networks in the environment, every day. A measurement of the intensive care beds, and there was a movement also of patients. So there are some advances, but the networks are now still in an early stage. So I'm convinced that we must prepare the governance of a network to handle a crisis like this in the future. And also, like Professor Vermassen said, not only with hospitals, we also saw in this crisis that very quickly we had to make some talks with our primary care physicians, also with the retirement homes. It was necessary. We asked already for that in the beginning of February, but there is no structure to speak with one structure to speak with that retired home. So there is still a lot of work to do, also by the government, to make an organization in a people health community that can handle a crisis like this.
Many thanks. After listening both you three, maybe we can highlight some elements that you said. Reinforce the coherence of these healthcare reforms on healthcare networks, the need to improve the medical cooperation guidelines within the network, the links to the first line and also to the elderly care institutions, and the need of reinforce the governance of the network to manage this kind of situations. If we move to the next topic that we would like to address, another important topic is the financial impact of this crisis. It has been very important. Less activity for non-COVID patients, extra cost for caring patients, extra cost for security, impact on doctors' remuneration. It's the end of fee-for-service. Do we need more integration between hospital and doctor payment systems? Do we need transitional funds during some months? A lot of questions arises on the financial impact. In this case, I will let Dr. Vermassen to start the answers.
Well, working in a university hospital, we have the advantage of not being paid for service, and I think this model actually showed its possible advantages in this crisis, of course, for many reasons. First of all, there are no problems with the payments of the medical doctors. That's one, and this also makes that there's no internal concurrence, and this means that everybody was always prepared to help each other, because it doesn't matter whether you work for yourself or whether you work for somebody else. So that model in a crisis like this has some advantages. I don't want to advocate or to change the whole health payment system, but I think this crisis made clear that also in this model there are some advantages, and yeah, maybe we should consider to go more to this, let's say, not a payment for not a fee for doing something, but yeah, just for to be paid in general with wages.
Great.
But that's a difficult topic.
Yeah, for sure. Dr. Brayson,
yes.
Your opinion on the financial impact?
Yes, we are a hospital with fee for service and independent physicians. So we see that the payment system like this is indeed not adapted to such a crisis. There is virtually no activity on the non-COVID front for about 6 weeks, 2 months. So the payment of the physicians, a lot of physicians, was probably 1/3, 1/5 of a normal time. So what we see now that an integration between the doctors and the hospital payment system is necessary. It's more necessary in the future. We need to be on the same target to the future, also the same financial targets. We have to discuss that with our physicians. What will we for what we will go the next year, the next 2 years, and what will be the financial targets, so that co-governance of physicians and hospitals is very necessary to handle a crisis like this and to have a system. And when you can think that fee-for-service is not the best way of remuneration, so probably there are some other lump sum with a part fee for services that will be probably better to handle some crisis like this. So we have to think about the future of our financial system.
Yeah, for sure. And probably one of the effects is that all these payment systems were based in a context of activity stability, no fluctuations, which is not the case today. Predictable, yeah. Stable and predictable.
Yes.
Dr. Deladriere, what do you think would be the financial impact, the need of transitional funds during this period, how to manage this situation?
I am in the same case than Dr. Brace, and the doctor in my hospital are independent, but I am more prudent. I think we are in a special phase, and the crisis can be or the reason to change and deep change or not. And I think that maybe it's not the right time to consider that the life of tomorrow will be the same life than now. I prefer to think that the hospital is like a manufacturer. I prefer to think that we need to be performant, we need to develop by ourselves, and we need support at this time. That's my point. That for this time we need support, but for tomorrow, I think we need to be performant, we need to develop, and that we need some freedom to do it. If we want to have a return on investment, we need an investment, and I fear that we need no, but we don't have to go too fast. So think that another system, completely other system, can be the solution for now or for the future. As I said, we don't know yet the future. We don't know yet, and I prefer think that we have to go by ourselves too. For the other point, of course, in my hospital, there is a real partnership between the doctor and the hospital, and it's normal that the doctor come in front of the door of the hospital to ask some money, but it's not really in front of the door. It's in front of the door of the authorities. It's not in front of the door of the hospital, you know. The doctor in my hospital have the same target, with sometimes some difference, of course, but with the same target than the administration. And I think we have to be prudent. We don't have to go too early to change everything. We have to think about it.
Many thanks. So be careful with the changes, but try to realign more hospital payment systems and physicians, more co-governance from both sides, and some questioning of the future of fee-for-services in a stable context. Another topic that we want to address during this webinar is how the innovation will affect to the care delivery and the value-based care. Why this question? Because the crisis has shown that doctors are not as conservative as they seem to be. They have changed very quickly, very agile, as we say today. They have implemented very rich solutions on digital care, reducing not added value activities once they have saw the recognition of work is unlocked. So how can we consolidate these changes? How can we spread innovation that we have been done during these last weeks? I will restart with Dr. Deladriere, who has the last one to answer before, and that's you have more space to answer, more new ideas to develop.
I have to say there is no to present and the future. Then certainly to present shown that doctors are and the globality healthcare workers are not so conservative, but in fact there was some rules. Financial rules, and rules by your corporation. And till now was new rules, crisis, give us another way to practice. And I think we are going further. We are going further for the future, certainly with condition. Condition is a financial respect of the job and of the investment. We need investment to go further for the informatics, for the digitalization. And we need a fourth actor. The first actor is the patient, the second one is the doctor, the third one is the authorities, but we need the private sector to go further. We need a certainly good partnership, win-win partnership to go further, because we don't have technical knowledge to go so far, but we are ready to go. And certainly we have, maybe we need some rules, more flexibility into rules to go further. But certainly in summary, we think that we are ready to go, but with a respect of financial aspect, with somebody else, a fourth actor, and certainly balance and rules to can go further in our adaptation, but we are ready to go.
Excellent. And Dr. Bermarsen, how do you think that this context will accelerate some innovations that we have implemented during this crisis?
Well, indeed, you already mentioned it. It's amazing to see how fast some adoptions were made and how fast some, things that everybody did in the future also changed. And I think that's fantastic. And some of these things will certainly change. Digitalization, for instance, these webinars, Zoom conferences, some of these will certainly stay present also in the future. And with regard to the relationship patient also, I think the video consultations or the teleconsultations is something that we have to keep to a certain extent, because it can really have an added value for some people. And these are some of the changes that certainly will be important in the future too. So we have to really try to keep them for better healthcare in the future.
Not to move back to the previous situation, to consolidate.
No. We have to keep what's good. We have to leave what was not good, but certainly to keep what was good.
Great, thank you. And Dr. Bracem, how do you see this topic?
Yes, we also saw that our doctors has shown to be very open to innovation and change, both during the peak of the crisis and also in the preparation of our relance plan for going ahead now the next months. And there are some concrete examples like education of physicians, of nurses to do other things in a short time. Also the teleconsult with the patients. I hope and I know already that it will stay in some disciplines like oncology to do short checkups of the patients by the physician by teleconsult. So also looking for other ways of hospitalization of the patients. Also some doctors of us of our hospital came with creative solutions. They cover to cover shortages of materials, for example, for ventilation and so surgical face mask. So I think that this situation has also triggered them, the physicians and the nurses, to think more broader, to think ahead, and to do suggestions to better things, to incorporate more efficiency. So I hope a lot of these things will stay.
Many thanks. Many thanks. I would like now to discuss an important issue. Is based on your experience, and the next topic is about how hospital management and leadership has changed during this crisis. For sure, it has been hard for hospital leaders, hospital managers and medical directors. But what are the positive lessons during this period on hospital management? What are the changes that you have introduced in management style or leadership style? What are the changes in way of working the crisis that you have implemented? Again, we changed the order. I will let Dr. Brayson to start the discussion.
Yes, first of all, in the beginning of the crisis, the leadership and the hospital management had to move very quickly. So it was surprising to see what kind of leadership there were in some people to take things up and to make it happen, to have motivated people around them and to make things happen. So these people we must also take with us the next months, the next years in very positions of our management of the hospital. But otherwise, the emotional side of the leadership also was very important. We have a crisis, so all things must go very quickly, but also we are dealing with people, physicians, people, nurses, other co-workers. They came for situations that were very hard to see, and also some were not used to see people that were dying. So also that side of our leadership had to be a very important part of our attention during the time now, in the past and ahead. So that's what I learned of it.
Yeah, an important attention on the emotional side, on leadership.
Yeah,
great. And Dr. Vermassen, what are the experiences on leadership during this crisis, the clinical leadership? And
well, there are 3 topics that I want to address, and actually, you know, these are topics that you will find back in every course on leadership, but that became more and more clear to be important during this crisis. And that's first one is be prepared. Always try to think at least 1 week or 10 days in advance. Think of what can happen in the future and make all arrangements so that you're ready when these eventually occur. The second one is teamwork, shared responsibility. That's very important. You cannot handle this alone. You're not a specialist in everything. This is one of the things I want to, you know, it's not criticism, but I don't know how, you know, no criticism. How a virologist can be an expert in hospital management. But anyway, that's another issue. So teamwork and shared responsibility is second. And the third one is clear communication. Communication is of the utmost importance to keep your institution and all the people that are working there together with you in order to be able to handle the crisis. So these are the 3 things that, for me at least, I learned that are very important in situations like this.
Yeah. So we add to the previous comment on the emotional leadership, the anticipation, be prepared, the shared responsibility, and communication.
Communication.
That's important topics. Great. And Dr. Delavier, how was your experience on leading this situation at hospital management?
Certainly the same for the emotional and the communication, and I saw that it was so hard to communicate in this kind of crisis, and I mean long crisis, because we didn't have to, we never know it before in Belgium, and it's long. But about the third thing about leadership is, of course, accept the help of a teamwork, and certainly agility, adaptation, and accept the error. I think it's really important in this kind of situation, the long situation. Accept the error, and be confident that you will be fine by yourself or with your colleague. You will be find a solution, and the solution will be maybe to answer. And if you don't find it, we will find another one. And I think for the future, it's really important. We know something completely different. It was a new world, and tomorrow will be another one. And I think it's really important. We were creative. We work with adaptation with other people, with team worker, and it's not so often. I think we learn humility in this kind of situation. And I have to say a positive aspect. Then for tomorrow, let me dream and go for it. We have all the ingredients to try to go further.
I think that this last comment is very important. So because you all three arise very important issues on hospital leadership. So how can we consolidate these important recommendations that you have explained in the coming years?
That's a challenge.
It's a challenge, but I think we have not the way to do it. We have to integrate our life of now and try to go further with this experience. Try to be a positive experience of the nightmare that we had.
Yeah. So thank you very much. I think this is a very good way to conclude this first part of discussing topics. We prepare also other topics, but as time moves forward, we will plan now to open some questions, an interactive way of discussion with the audience, with an app, the MedMeter app, that our colleagues now will explain. Frederick van Asselbroek will explain the technical aspects, and Mark van Wieten will manage the results interpretation.
Okay, Frederick, it's good to you to start up and explain the tool that we were going to use for this
yes.
part of the session.
Can you confirm that you all see my screen?
Yes.
Yes. Okay. So, hi everybody, I'm Frederik van Asbroek, and as education leader for Johnson & Johnson Medical Devices, I'm happy today to actually facilitate this interactive question session and answer session. Now, in order to give you, let's say, 2 minutes to set up, I would like to ask all of you to grab your phone, your smartphone, your tablet, or you can even do it on your PC, and then go to your internet or web browser and then fill in menti.com or go to the website menti.com. And when you do that, you will be able to fill in a code to participate. And this code is 480122. I will repeat, 480122. So I just give you a couple of seconds to get connected. Now, while we are going through the presentation or during this session, you can continue to join if you want, because at all times there will be on the top of the screen the website and the code visible. Okay. So before we get started, we have prepared actually two, let's say, warm-up questions, which allow us all to familiarize yourself a little bit with the approach. And the first question is actually, did you dream about the coronavirus last night? And I see already some answers coming in. So I will just give you some time to share your answers. So we already have 22 participants in total. Okay, great.
I think what we see is that 20%, 1 on 5, has dreamed about COVID last night. So this is remarkable. It is on top of dreams, and that is it is everybody working in healthcare is concerned with this and is dreaming about or has some strange things that he reminds of before, and that now is not possible, or he dreams about, I don't know, whatever. It's a lot of us related to coronavirus. Interesting.
Yeah, Thank you, Mark. So we can go now to the second question. Normally, if you have answered, it will automatically continue to the second question. If not, you can always tap on next question. Today, with which word or words or feeling would you describe the COVID-19 crisis? So you can answer anything you want. Please be aware that any answer you give is, of course, registered anonymously. So in terms of privacy. So we see a lot of different questions popping up.
Okay, it's stabilizing. One of the first things that came up on the screen was scary. I think everybody had been a little scary about a thing that was unexpected. That was it was announced, but it is only in films that you saw their scenarios, and it gave a lot of uncertainty. And of course, leadership is about dealing uncertainty. And interesting because it gives some kind of opportunities to do new things, and that what is what we have seen into the time we spend. And of course, one word, I don't want to say it. It normally is a four-letter word. A lot of people will have said that, but they don't dare to write it down, because I was used to do this. Everything. How will we deal with it? I think a lot of big words will have been used during dealing with the crisis. And what I saw in the beginning was also, did we react enough, or did we overreacted on it? When you were seeing the situations in Italy, it was certainly the COVID, it gives an enormous stress on intensive care beds, and we had to react to contain the virus. Of course, it was regionally differently spread into the country. Of course, I think this was the things we see here in the word cloud.
Thank you very much. Then we go over to our third question. Could you list your main priorities priority in the upcoming months? I will give you some time to fill in. I see the answers coming in. Thank you.
Okay, a lot of things that are coming up into the screen, but there's one big word in it. It's popping up. It's about health. It is not about illnesses. It's about health. It's about population health. I think that this is one of the big stresses that we got into the crisis. Everybody knows that health is now a social good. It is, and health is important. We can see what is happening when the health is not dealt with. So it also, what we see is, we saw money, we saw change. There's maybe when we have this interaction concluded, there's also one question out of the audience. Will this crisis, will the financial impact, because the word of money came into the screen also, could bring the authorities, could bring a government, could bring healthcare leaders to a redesign of the system with more vertical integration. So this is one major topic that we can do after this thing, because you see there's a lot of focus on population health. So this is, and the mission of healthcare is now very clear. It's demonstrated. We saw what it is. And will we do it in the same thing? And that vertical integration, we saw how dependent we are of a good interaction with the general physicians. What we had with the elderly homes, problems, people homes where people living with a handicap and lack of social contacts and such things. That's maybe a question that you can deal with, Johan, after the interactive part here.
Okay, thank you. So let's go over to our fourth question. What is the first big investment you would consider because of COVID-19 that you would not have considered 3 months ago? We see reactions coming in. We will give you a couple of more seconds to give you the time to answer.
I think the answers are now stabilizing.
Yes. Yeah.
In fact, this is what we have seen, the innovation and the digitalization that was needed to reform, to cope with in the interaction with the patient was very important. So it is in the direct relation with the patient, with tele healthcare. We were talking about 10, 15 years about the possibility. Now they are reimbursed. It's important to keep those instances and to keep that digitalization of all our administrative processes and such a things to avoid waiting lines and such a thing. But that is a very important part of it is also the human touch. So it is digitalization with a human factor because of what we have seen in dealing with the crisis. The care was trying to keep the patient alive, to save the patient, and it was very unhuman because of the fact we could not do otherwise. And that is why it is hard for the professionals taking care of the patients, but also for the families to hand over the patient to the hospital. And this is a very important thing, the combination of digitalization to have more space and more space for human aspects of interaction with the patient.
Thank you, Mark. And then we all go over to our last question, the fifth question. Is there a specific message for the medical devices industry, for example, Johnson & Johnson, related to the recovery phase and beyond? Again, we will give you some time to reflect and to type in your feedback. This time it will not appear in a word cloud. It will just populate the screen and start scrolling so all answers become visible. If you can comment, Mark,
yes.
I think we already have some valuable information.
We have seen, and also in the debate, it came on front that actors in healthcare and hospitals want to have the industry as a partner. That's a very important thing to see. And because they are partnering in getting also in dealing with crises, but also to have partners into supporting the core business of the hospitals. There was a concern and about supply chain security and assessment. And there's one thing that is new here on is a production in Europe. That's sometime we will need the industry to think about how to partner and to see how the dependency on the global markets, because we have seen during the crisis there were some concerns in it. We saw also an aspect of transparency, partnership, support, training, data sharing, partner in digitalization. I think there's a lot of interaction. There's a lot of, this is a very interesting question. There's a lot of opportunities to take up by medtech industry in general, and especially for here in Johnson & Johnson, for instance. There's a lot of opportunities to deal with, and there really is a need. As you can see, it does not stop the list in this on this question.
Okay, thank you everybody for participating and for the feedback provided. So I will hand over now. Yeah.
Okay, I will hand over to Johan. That question about the vertical integration in care, maybe this is a thing that we can discuss along with their impressions on the questions here.
Excellent, Mark and Frederick. We are closing to the end of the webinar. It was very interesting, these also open questions, which are very complementary to the comments that you made, all the three speakers, and I will really acknowledge your participation, the rich contributions. I took some time to review the comments that we received through the platforms that are in line with the discussions. Some comments reinforcing the idea of strengthening the healthcare network with primary care and also elderly care that we already discussed during this panel, and also the need to reinforce the digital strategy. So some comments that we received from the participants on this webinar that are aligned with the discussions that we had. As we are at the end of the webinar, I would like to let Dr. Gilbert Bejani from the Belgian Association of Hospital Directors to close this webinar in the name of the Hospital Association.
Hello, everyone. Can you hear me? Are you hearing me? Yes? Okay. I would like to thank Johnson & Johnson for allowing us to do this webinar. And I want to tell you that I learned a lot today. So let me give you in a few lines what I learned as a take-home message. I will do it in two parts, the leadership and let's say the healthcare system and the future of it. You know, usually we speak about a good leader in an old fashion is a good manager. That was the CEO, let's say 1.0. And the last years we heard about the good leader as a CEO 2.0. is one that makes a good assessment of the organization, the one that values the people and their skills and that identifies rising skills. And I heard that too today. And it's also one that combines strategic skills, innovating skills, business skills, and relational skills. And what happened, let's say, in the last decade is it was about the leader 3.0, which is one that delivers all of what I've said and who dreams, who can keep discovery onward. And that is what I heard today from all the speakers who really mentioned all these new items in their leadership capabilities. I'm gonna just give you some reminders of what I heard. I heard people that adapt, and that is really that is something really new about leadership. It's people who, as Eve said, keep the people who make it happen. So it is identifying the rising leaders of tomorrow and keeping them in the organization. I heard also two speakers who mentioned the emotional capabilities of the new leadership. And that is really important because we had to deal with a lot of stress and a lot of deaths also. And the last maybe important word in leadership was communication. Communication is fundamental in the organization, and we also discussed that in the last webinar, how to do it, how to make it efficient in the organization. And at last, Dr. Deladriere spoke about the creativity we had, and I began by saying that the leader 3.0 is someone who dreams and who can innovate and be really creative, and that's also what I heard. So I'm really happy that our leaders of today are really 3.0 leaders. As for the system for the future, I heard a lot about the capacities of adaptability and reacting to uncertainty. This is something fundamental because it was also here before the COVID crisis. We live in a world where where the future is not certain. It's not. It's something that organizations today have to deal with, and the COVID crisis was the best example and challenge of uncertainty. I also have to mention the crisis as opportunity to change. And as you know, resistance to change is of major concern in organizations. And I'm really happy to observe that a lot of things were possible, and we could, like the implementation of telemedicine, it was debated for 2 years, and then it happened in 2 months, in 2 weeks. So a crisis could really be an opportunity to change and an opportunity to go through the resistance that we usually face. I also heard the need of freedom in action, and that is also something that our system have to deal with. It is a request from the leaders in the healthcare system. They really need some less regulation and more freedom. And I also heard the word partnership. You know, partnership is what I learned last year in SEAD. Partnership is fundamental in creating added value and in propulsing innovation. And at last, cooperation and co-governance in a way where it is also sharing the responsibility and sharing the benefits. And I'm really happy that we could go further in finding a way where the fee for service system is not anymore the only way of working and the only way that we worked with in Belgium for the last 50 years. And before giving the word to Monsieur de Genève, who would like to conclude, I would like to say that leaders of tomorrow will be adaptive, and I am happy that our speakers today prove themselves as leaders of today and leaders of tomorrow. And I would like to thank the three of them for what they have shared with us. Thank you.
Thank you very much. Thank you very much, Dr. Bejani. I think I'm super pleased about this discussion. We know this exercise is not easy, but I thought the flow was great. And as always, we can learn so much from each other. There was so many things shared today. So I'm so grateful from the Belgian Association of CEO. Because this was an idea we have together, but I see the benefit was tremendous, and I think it can lead for similar approach in the past. I've seen also that we need to reinvent ourselves, the way surgeons, CEO, CMO, patient, and industry. We should collaborate more, and we should support each other, because the challenges are much more acute now. So I'm going to thank you again, and I wish you a lovely evening. Bye-bye.
No one is speaking.
1 second, please. Just 1 second, please. Okay. Everybody.